Today we're speaking with Dr. Edith Perez, Deputy Director of Mayo Clinic Cancer Center in Jacksonville, Florida. Thank you so much for joining us.
My pleasure.
You currently oversee more than 30 clinical trials that explore the use of new therapeutic agents to treat and prevent breast cancer, including ALTTO. Would you discuss ALTTO and where that study is now?
ALTTO is a trial to attempt to optimize adjuvant therapy for patients with HER2-positive breast cancer. So ALTTO is a global collaboration. So the trial is being conducted throughout the world to test one of 4 anti-HER2 strategies in combination with chemotherapy. So patients undergo surgery. After the tumor is resected, then the patients can participate in the trial that tests chemotherapy with trastuzumab, chemotherapy with lapatinib, chemotherapy with a sequential approach of trastuzumab and then lapatinib, and the 4th arm in which patients receive chemotherapy plus the 2 anti-HER2 drugs, trastuzumab and lapatinib. And we've known, based on results of our own studies and others, that trastuzumab is currently the standard of care, but we're trying to determine whether trastuzumab can be substituted by lapatinib, whether we should use the 2 anti-HER2 drugs either in sequence or in combination.
Based on your work with clinical trials that examine the molecular basis of response to therapy and the studies you've developed to evaluate the role of genetic markers for breast cancer, what are your thoughts on how the field is moving forward and moving toward personalized medicine?
I am very enthusiastic about the strategy as well as the data that are becoming available in the context of our research related to personalized medicine and the ability that we will have in the next few years to truly understand the biological basis of breast cancer. And I think that will be extremely helpful to select the best therapy for the right patient.
What are some of the challenges with treating patients with triple-negative breast cancer, and how do you think personalized medicine may be able to help them?
Yeah, triple-negative breast cancer has become almost an orphan type of breast cancer because we have not had the identifiable targets that we can use to select treatment. So at this time, patients are treated with chemotherapy, and the challenge has been that we understand that many of these patients do not do well over the long term, and we need to do our work to obtain tumor specimens that they need to be provided, with the consent of the patient, so that we can do state-of-the-art molecular testing of the tumors, so that we can unravel the biology, so that then we can find better treatments. One thing, though, is that there are some very important new agents currently under evaluation, which are part of clinical trials, and I think that we will see some data even within the next year that may have a major impact on patient treatment.
You presented a talk to advocates at the Alamo Breast Cancer Foundation Patient Advocate Program. Would you explain the need for advocates in cancer research and what can they do to continue an advancement towards cures?
It was truly an honor, actually, for me to do this in the context of this San Antonio breast meeting. I was very impressed at the large number of persons who showed up at 7 o'clock in the morning, demonstrating the interest that they have, which is joined to my interest to find best options, which needs to be accomplished through education as well as clinical trials. But we need to go beyond clinical trials because we need to not only do studies, but we need to educate our patients, our physicians related to the new data on how they can best be incorporated into clinical practice. So I was thrilled by the participation, their enthusiasm, their questions, and advocacy is extremely important to keep up the discussion alive and to encourage others to continue to provide very focused research funding so that we can do the appropriate laboratory and clinical trials.
And Dr. Perez, what advice can you offer patients to ensure that they get the best care?
Patients should be involved. The days in which we didn't want, or other physicians didn't want to have patients looking up data are over. We want the patients to feel that there has to be an open communication. We want the patients to feel free to look up information and to discuss it with their physicians. Very important, because some of the information out there may not be totally reliable. So although I want my patients to be educated, that education needs to occur as a collaborative effort between the patient and the physician. And that way, the patient can then get all the questions answered. And I think this will ultimately turn into better care.
Dr. Perez, thank you so much.
My pleasure.